at the Free Market Medical Association, you discussed a very, very special story that I think made everybody in the room, it made their hairs stand up on their arms. So can you tell us that story? Very personal.
Yeah, it is very personal because it's been a significant part of shaping my medical career and the things that I've done around the medical world. I think it was the winter of 1975-76. And in Britain, it was a winter of discontent. The family doctors and all doctors, I was still in a residency program. For the first time ever, doctors working in hospital had gone on strike. And so at a go slow, where technically we had said as doctors we would only work 40 hours a week because we were typically working in our residency programs more like 100 to 120 hours a week. Actually, because of what was going on in the nation, which now included a flu epidemic, very reminiscent of where we are with COVID at the moment, all of us were still working 100 to 120 hours a week. And flu is a serious killer. And so people were dying like flies all over. And on this particular night, the group of physicians I was working with that I was training under, we were responsible for the hospital intake for that night. And Mr. Smith was admitted under our care and was on my ward where I was the primary physician responsible for him. And, you know, he had the flu and he had pneumonia and he was getting better quite quickly. So he had only been with us 4 or 5 days. I came essentially with a view of doing a discharge medical on him, checking everything was okay. And when I was listening to his chest, I couldn't hear things really well. And I said, you know, do you mind, Mr. Smith, just slipping out from the bed and standing up so that I can have a proper listen to your chest? And as he stood up, he had a cardiac arrest. And so immediately we called the crash team. We were able to resuscitate him. And for the next couple of weeks, he was hanging between life and death in the intensive care unit. And then he began to slowly recover. During this now protracted period of time, I got to know him pretty well. And he was a fascinating guy. I'm so glad that I've always loved my patients enough to, ask them meaningful questions and to be willing to expose myself as well in that sense. And I found out that he had a number of kids. Now, this was important, though, because when I asked him about what they did, one of them actually was chairman of our area health authority. So meaning about 20 administrative levels beyond me as the junior doctor there. He had a son who was my boss. I'm glad I found that out. And I also found out about him. He was a fascinating guy. I lived and worked in the East End of London, which, if any of your viewers have seen things like Call the Midwife or EastEnders, they'll know it's a poverty-stricken part of London. And he was a cobbler. He made shoes and he made handbags. And that's actually a very important point for this story, because it came to this now last day when he was ready genuinely to go home. I got called on my pager. We used pagers in those days. And when I called, they said, Mr. Smith is ready to go home, but he'd like to see you before he goes. And so I said, of course, I would be delighted to see him. And I came down to the ward. And he pulled out of his bedside locker a package. And he said to me, "Oh, Dr. Dale, I've got a gift for you." Then he said, "Oh, well, actually, it's not for you. It's for your wife. I know I'm not allowed to give you anything." And I thought to myself, not being necessarily totally altruistic, "Oh, why aren't I allowed to get anything?" But be that as it may, of course, I very quickly pushed that away, and I said, "Oh, well, thank you so much." And he said, "Oh, it's kind of special. It's a handbag," but he said it's identical to the handbag that I made for the Queen.
Wow.
Now, when you're English, that's like amazing. And my wife still has that handbag. She hardly ever brings it out, but on super special occasions, it comes out. But, what changed my life was what came next. As I walked away from his bed, and, maybe not all your listeners will sort of understand exactly what I'm saying here, but there's that sort of still small voice inside. Many people would call it conscience. For me as an active Christian, I would call it the voice of the Holy Spirit speaking to me. As I walked away from that bed, it was like this still small voice inside. And this is the weird thing. It sounded really sarcastic to me. And it was like God was saying to me, "Well, Tony, You know, everybody thinks you're fantastic. Mr. Smith just told you how fantastic he thinks you are. The nurses and the staff here, they think you're fantastic, but none of them know why. And he reminded me of something that I'd been reading. I, take Bible reading seriously. I feel there's so much to learn from such an amazing book. And I've been thinking about a verse that comes in one of the Old Testament prophets where it says this. It says, "I am the Lord, that is my name. My glory I will share with no other." And I found myself thinking as I walked away from that bed, if I was going to live an honest and integrated life with my patients, with my colleagues, with my family, then there's no way I could take glory for what God was doing inside my life. And I had to learn how to open up, even like in a time like this interview, to say the reality of what we can experience, and of, if you like, the joy and the peace and the competence that others might see in my life is a direct consequence of the way God has worked in my life, for which I'm just so profoundly grateful.
Well, I think that comes out as obvious when people talk to you, and I know it does when I talk to you. So thank you so much for that story, and thank you for being on our show today.